Over the last 2 years, the evaluation team has been gathering data to learn how Good2Talk is supporting students. Data came from everywhere, from the partner organizations, from callers, and from campus staff. We gathered it all together and discovered the support you provide is seen as invaluable, really needed, helpful, superior, and awesome. We asked callers many questions about their demographics, how they experienced Good2Talk, and if they experienced a change after their call. So who are they? Who is calling Good2Talk? Well, of the callers who completed the evaluation survey, 93% spoke English as their primary language, 66% self-identified as female. Callers ranged in age from 17 to 52, and the largest number of surveyed callers identified as being 21. 18% of callers fell outside Good2Talk's target demographic of 17 to 25 years of age. 90% were full-time students, 72% attended university, 53% lived in the Greater Toronto Area. In terms of the callers' living situations, 44% lived off campus, 35% lived with their parents or a family member, and 15% lived on campus. Just over half of all participants moved away from their home community to attend post-secondary education. So how was their experience? Overall, it was positive. Callers felt listened to and that Good2Talk helped them with at least one concern they wanted to address. Qualitatively, we discovered that Helpline staff are largely seen as resourceful, empathetic, and helpful. Callers appreciated when they spoke to a staff member who was able to balance listening with providing suggestions or direction. Most telling and impressive is that 94% of callers told us they would call Good2Talk again. 94% of callers also told us they would encourage a friend to call if they needed support. We don't know about you, but we wouldn't tell our friends to call a helpline we weren't happy with ourselves. What changed for callers after their call to Good2Talk? Most callers agreed that after receiving counseling, they felt less distressed, more hopeful, and more aware of their personal strengths and abilities. Most also agreed they were better able to cope with their concern, had a plan for how to handle it, and felt increased confidence in their ability to do something about the problem they had called about. After receiving information and referral services, most callers reported being more aware of available on-campus or off-campus services, felt they had more options available to them, and similar to counseling, left with a plan for how to handle their concern. Of those callers that received a referral, 70% intended to follow up on it. What about campus professionals? What do they think about Good2Talk? Well, we asked a sample of campus professionals what they thought about Good2Talk through survey and focus groups. We discovered 84% had referred at least one student to Good2Talk, and that 47% of those who had referred recommended the helpline to 1 to 5 students per week. The main reasons for referring a student was for after-hours crisis support, support between appointments, and because the referred student would benefit from an anonymous service. The focus groups taught us that staff on campus view Good2Talk as a valuable part of their toolbox, given it extends the continuum of care by offering professional services 24/7. While they identified some challenges with phone services and provided some suggestions for ongoing improvement, such as continued training for staff and expansion to web and text-based services, overall Good2Talk was viewed as a useful addition to the services available to post-secondary students. So what? What did we learn from the evaluation? Well, the evaluation demonstrated that the post-secondary community, staff, and students report being satisfied with Good2Talk and would like to see it continue. While there's always room for improvement, it appears Good2Talk is seen as a valuable service that is important in supporting post-secondary students' mental health and emotional well-being.